we are when we are going to treatment response, it is very important to understand that we need to control what is happening from the clinical point of view, but not only from the clinical point of view. Also here, MRI is key. And of course, we need to control inflammation in terms of not having relapses, but also of not having new disease activity, not having new T2, etc. More controversial is still how to use biomarkers such as neurofilaments, which work very well at the group level, but more controversies exist in how to use them more at the individual level. Also, neurofilaments, they are predicting inflammation, but once we are in NEDA and once we are using these very high efficacy treatments, and we can say that our patients are rid of inflammation because they don't have relapses and they don't have new T2s, you know that PIRA can still be present. And our patients, unfortunately, may still doing this progression independent of inflammation, which is the meaning of PIRA. And here it is not so clear if neurofilaments are really contributing when we are completely rid of inflammation. And here is where maybe other biomarkers, MRI biomarkers, such as the very promising slowly expanding lesions that we can now detect with certain sequences in the MRI, could play a role. This is still also in debate, but these slowly expanding lesions seems to be at least partially responsible of this progression independent of relapse activity. And if we could really target them and count them and control this would be very, very promising for finding drugs that really focus on progression.